Hello and welcome to another Tuesday Talk with Ruby Reese. As many of you will know, my name is Killian. I am co-founder at Ruby Reese and I will, as always, be your host. This week, the introduction is not about me and it's all dedicated to you guys, the listeners. We've had the pleasure of meeting loads of you at live events over the last couple of weeks, and it's been fantastic to get feedback, to get ideas for the future, and we thank you for your comments. I don't always do well in associating the online world, and I kind of take this podcast to be part of my online world and the real live world. I don't do a very good job of connecting them, but we thank you nonetheless for coming and speaking with us in person. We do appreciate it, both Chris and I, seeing as Chris has an equal role to play in this podcast, as he does all of the editing and lots of the behind the scenes work. And we also thank you for being such great, loyal listeners and sharing the podcast and recommending it to your friends. You're doing a fabulous job. And also, of course, many of you for coming on and speaking with me as well. It's an absolute pleasure. So whether you like it or not, if you're a regular listener to this podcast, you are part of a community and we appreciate you more than I can probably put into words. So without getting too emotional, now it's time to change gear and talk about what our topic for this week is. Osteoarthritis, one of the biggest issues that we see around our pet dogs, particularly around their joint health. And I've had the absolute pleasure of speaking with Deirdre, who is a physiotherapist and shares such brilliant insights into osteoarthritis in dogs. So without further ado, I now welcome you to listen into the chat that Deirdre and I had. Deirdre, thank you so much for coming on and joining us on the podcast this week. How are you doing?
I'm great. How are you, Killian?
Very well, thank you. Would you do us the pleasure of introducing yourself briefly?
Yes, of course. My name is Deirdre Duggan. I am a small animal rehabilitation therapist and veterinary nurse. My business is called Pet Paws Physio, and I provide a physiotherapy and rehabilitative service which aims to improve, maintain and restore movement and function and address any associated pain in the small animal patient. So my business, basically I'm assessment driven, and all my treatment depends on my assessment findings, and I use a combination of different physiotherapy modalities then to help meet the patient's individual goals. So that's it in a nutshell.
Brilliant. Thank you very much. And I know that physiotherapy can help in so many different cases, but we've picked a really, really interesting topic for this evening's podcast, osteoarthritis. So maybe it's a good place to start with what even is osteoarthritis.
Yeah, so if you look at the definition of arthritis, it's simply an inflammation of the joint, okay? But in reality, it's way more complex than that. It's basically a chronic, incurable, progressive inflammatory disease, which affects all the structures within the joint and also the structures outside the joint, because it has a knock-on effect in affecting those structures as well. So it's a really complex condition that it results in pain in our small animal patients, and requires a lot of multidisciplinary team approach then to help approach the issues that it causes, basically.
So when we try and break it down, when we're talking about the joint and the areas around the joint that are affected, does this mean that are people to be thinking about like the bone, the cartilage, what's really affected in osteoarthritis?
So a lot of people think it just affects the cartilage, but in actual fact, so the cartilage is like the shiny surface at the end of each long bone that it's the articulating surface, and it should be nice and smooth. And two long bones meet to form a joint. Okay. So basically, arthritis is basically an inflammatory condition where the joint is the inflammation causes a degeneration within the joint and affects the cartilage. Then it affects the synovium, which is the inner lining of the joint capsule. The inner lining of the joint capsule, the synovium, is really important for producing synovial fluid, which is provides nutrition to the articulating cartilage, that shiny surface. But also provides lubrication for the joint. So it's like the WD-40 for the joint. So so basically this inflammation that starts there affects the cartilage, affects the synovium, which has a knock-on effect of affecting the production of the synovial fluid. And all of these will cause a chronic inflammation, which causes osteoarthritis to form. But it also has a knock-on effect by causing the dog to, we'll say, offload the leg, which has the knock-on effect then of the structures that support the joint, such as the ligaments and the tendons and the muscles that support the joint. So they're the dynamic and the static restraints of the joint, but also they move the joint, the tendons and muscles. And it has a knock-on effect by affecting how they're utilized, because the dog is offloading the leg, we'll say. So it result in weakening of all those soft tissue structures then as well. So that's why people think of it as just affecting the cartilage, which we do get degeneration of the cartilage, but also we get degeneration of all the structures within the joint as well. And then that knock-on effect of how it affects weakening of the ligaments and the tendons and the muscles as well. And then we have the knock-on effect then, of course, if a dog is offloading that leg, they're going to be overloading another part of their body. So we got the compensatory movement patterns then coming in on board. And they, if a dog is compensating, they're going to be overutilizing some muscles. So that we're going to get reduced blood flow and oxygen to those areas. We're going to get compression of nerve endings in those areas and pain. So soft tissue tightness and pain in those areas as well. So we're dealing with the secondary issue and pain from compensatory movement patterns. And then we also get an increase of pain signaling coming from the joint, going to the brain. We get an exacerbation of that. If it becomes a chronic pain, we get that continuing on. And that's where we can get like an amplified version of the pain, because it's chronic, this continuous pain signals going to the brain. The brain perceives it as pain, and that's where it becomes a more exaggerated type of pain, and that's where we can get like something called central sensitization, which is a really hard type of pain to control then.
Okay. So they're offloading the pain, they're trying to look after it, and then the brain is telling them that they've got an awful lot of pain going on as well, probably telling them even more to take more weight off that joint as well. So it sounds like it can lead to very, very serious issues. And how common is it in our dogs?
It's extremely common in our dogs. So with 80% of all dogs over 8 years of age known to have osteoarthritis, and 35% of dogs of all ages are known to have osteoarthritis. So it's really common in our dog species.
And talking about age, like, is there a specific age that dogs typically start to show the signs of osteoarthritis, or can it kind of occur at any age?
So historically, we thought that it was an old dog disease, and and a lot of people still think that. But in a recent study carried out by Professor Duncan Lascelles of North Carolina State University in conjunction with Elanco, they found with dogs between the ages of 8 months and 4 years that 41% of those dogs had radiographic evidence of osteoarthritis. So that, that was a bit of a shock, because dogs as young as 8 months were showing signs of osteoarthritis. They also found, within that study that 24% of those dogs had pain associated, so mild to moderate pain associated with those joints that they found radiographic evidence of OA. And within that, just to carry on with that study, because there's some interesting findings in it, within that 24%, there was 57% of those dogs, of owners of those dogs, realized that there was some form of, something wrong with the leg, or, something not quite right. But only 13% of those dogs, should I say, were on medication. So, which is a really interesting finding as well. So it just tells, what it tells us really is that, number one, dogs can get osteoarthritis at any age. Okay. From the studies, from as young as 8 months. But also it tells us that we're just really bad at picking up the early signs of osteoarthritis. And we know that 50% of dogs over the age of 8 have progressively significant osteoarthritis. So significantly bad osteoarthritis. So that tells us, we're not picking up on the signs sooner, that we're only realizing at a really late stage that they have really significant progressive osteoarthritis.
And then it's probably even secondary causes, like you say, secondary problems that they have from offloading and things like that we might be picking up on as well.
Exactly, yeah.
And talking about who gets osteoarthritis, are there specific dog breeds then that are more prone to developing osteoarthritis?
Well, there is a genetic, some breeds that are genetically predisposed to getting osteoarthritis. So there certainly is that element. So dogs such as Rottweilers, German Shepherds, Labrador Retrievers, Spaniels, French Bulldogs, they're typical breeds that you can think of straight off that, are more prone. But we know that any dog of any breed can develop osteoarthritis, because we know that there is a genetic predisposition to it, definitely, but we know that osteoarthritis can be formed when there is abnormal forces going through a normal joint, or when there's normal forces going through an abnormal joint. So if a dog has had injury to a joint, if they damage the joint, if they're in a car accident and damage their joint, for example, they will be predisposed to osteoarthritis. If they've had a soft tissue injury that's maybe affected how they move the joint, that could put them at risk. And potentially, like if a dog has had an injury to any limb, even if it's a long bone, but we'll say they're overloading another limb, that could put those joints. So if they hurt their left hind leg, for example, they're overloading their right forelimb, that could put that right fore wrist or carpus at risk of developing osteoarthritis, because it's an abnormal force going through a normal joint, so it's an increase in load. So, that's where it becomes really interesting, and where my job, I suppose, comes in then to try and counteract those problems from occurring. But also we know that dogs that are obese are more prone to developing osteoarthritis. So it's any dog.
I was going to say, is it potentially with dogs that are obese, it's probably the loading of the joints again that could be causing the issue originally, is it? Exactly,
yeah. That's it.
And what are common signs and symptoms that people could be looking out for?
So you're looking at subtle signs. So again, because it's a chronic condition, we tend to see subtle signs, subtle changes gradually over a period of time, over a long period of time. So a lot of people will come to me and they'll say, they seemed absolutely fine, they were doing great, and then suddenly, they're not. But then, you're kind of, you're putting a picture together and it doesn't all seem to add up. Because generally people are missing the subtle signs. So we're looking at changes in subtle signs, subtle changes in behavior, subtle changes in posture, subtle changes in their movement, and subtle changes in their appearance. So, for example, changes in their behavior. So if you've noticed that they start slowing down in their walks, if they seem to be reluctant to go on their walks, they're reluctant to get out of bed, they, seem maybe, sometimes they might seem a bit crankier. They might sleep more. They might sleep less. They might be restless because they just can't get comfortable with their sleeping. They might be not as engaged as they normally would have been. They might not even come to greet you, so changes like that can be an early sign that they're feeling pain. And then also changes in posture. So, for example, you might notice that they're arching their back. Their tail might be held very low, or they're not using their tail at all, or they might be holding it just in one position straight out. Just a change in how they use their tail. They might seem stiff getting up. Sorry, that's changes in movement. But also, you might notice that their hind legs have got a narrow base of stance. They're holding their hind legs together, or they're holding them way out wide. They might be holding their head and neck very low. So they be signs of like postural changes. Changes in appearance. Then you might notice that their back end looks a lot skinnier than their front end. So they look like they've got a big neck and mane. And they look like almost like a bodybuilder in the front. And they look really skinny and look like they've it's because they've lost muscle mass in their hind region. You might notice that their hair might be a bit coarse or dry in certain areas as well. So then changes in movement. You might notice that when they're getting up from sit or lie, that they're pulling themselves up. And a lot of the time we'll see, because they lose a lot of muscle, they can lose a lot of muscle mass in their hind legs. They're, rather than powering from behind, they're pulling themselves up from the front. So they look more labored in how they're transferring their weight from sit or lie into stand. You might notice that they are veering to one side. So when they're walking, they might be not walking straight. They're kind of just veering to one side. A lot of people, some dogs, they have a natural waddle. But sometimes that can be indicative that there's something else going on as well. That you might notice that that's increased. So that can be a problem too. That might indicate that there's some problem. You might notice it's not always like people will think of things like, but if they were in pain, they'd be lame. But that's not always the case. That's a severe reaction. So there are all these little subtle signs before there's the more obvious signs. So it's trying to catch those subtle signs and take notice and actually do something about it then as well.
Yeah, and it sounds like there are lots and lots of different indicators here. And in fact, we did another episode previously with Killian from Little Woofers on undiagnosed pain. So that's something that people could go and listen to as well if they're looking for even more signs. But I think you covered an awful lot of them there that could be potential. And then I suppose, how is osteoarthritis actually diagnosed then? What's the point where we can actually look at and say, this is evidence that we have osteoarthritis?
So if you suspect anything, so any subtle signs, and you notice that there's a bit of a pattern, there's a couple of things going on, and it seems to be going on over a couple of days, a couple of weeks, going to your vet is number one. And then what your vet will do is they'll do a gait analysis. They'll watch your dog move. What I would suggest is I would record anything that you see abnormal. Okay, because your vet only has 15 minutes, generally 15, 20 minutes consultation time. So I would, anything abnormal that you notice. So try and record it, try and take a picture of it, note it down. I would highly recommend having just a copybook or a diary or something on your phone that you can just note down. Notice today skipped on one leg or dragged their hind feet. I could hear their nails dragging on the ground, and that's something I hadn't noticed before. So, so noting down any abnormalities that you're seeing and that you aren't sure, is it something to worry about or not? So that's number one. Number two, then when you go to your vet, they'll do a gait analysis. They'll watch your dog move. They might watch your dog sit. They will palpate. So they'll feel along the muscles. They'll flex and extend all the joints in the limb that you feel there's a problem. Or they might do a general check. If you're kind of going in and saying, I'm not sure there's something not right, they might do a general check. But what they're trying to do is locate where is the pain. They're trying to break it down to try and find where do we need to focus our attention on. So generally speaking, then they might find pain in the hip area, for example. They might find soft tissue pain, or they might notice that the dog isn't flexing, extending the joint properly, and they've got reduced range of motion maybe. They might notice that the dog maybe is sitting to one side. So that's kind of leading them in their investigative process then where they should focus in on. And then generally, a lot of vets will take x-rays then. So they usually take an x-ray and confirm that there's osteoarthritis there as well.
Okay, so this is something that'll be visible then on the x-ray.
Yeah, exactly. Now sometimes, depending on, because not there's different reasons, and that you may not be able to do an x-ray for whatever reason. Maybe there's a concurrent condition going on. The dog has another condition, and so for whatever reason, it's not appropriate to take an x-ray at this time. But, there might be different reasons. So they might just decide, okay, there is a little bit of pain here. Let's put them on pain relief for a couple of weeks and just see how they get on. And if there's a big improvement, great. We'll take them off the pain relief, see how they get on then. And if it returns again, then we might investigate and do x-rays then. So it really depends, because if there's severe findings, they probably will do x-rays there and then. If there isn't, and it's more subtle and they're not 100% sure, or they can't localize exactly what's going on, they might do a trial and error, like a pain medication trial, just to see, okay, can we just see, is there actually pain there or what's going on? And sometimes they have to go down that route as well. Because otherwise they might end up having to x-ray loads of areas in your dog and come up with nothing, so just to help them with their investigative process. Yes,
it's a process of elimination, really, to try and really figure out what's going on. That can be
the way it is in some cases, but mostly, like, if everything is straightforward, the ideal scenario is that you just do x-rays and then you come up with a definitive diagnosis, and then they would start you on pain relief medication then.
Yes. And so now we have our diagnosis, and we're moving towards treatment, hopefully. And you mentioned something beautiful at the beginning of this conversation about building a team of professionals to work kind of in a holistic care scenario for your dog. So I think this is super important. I know we mentioned vet, and I'm sure there's other professionals coming involved here now in the treatment as well. But what treatments and therapies are even available for managing osteoarthritis? Yeah,
so as you said, the multidisciplinary team approach is so important. So having a multimodal approach where we're not just targeting. So the number one symptom, I suppose, is pain. So we want to treat the pain. You can't not treat the pain. You have to treat the pain. A lot of people try to avoid going down the medical route of treatment. The problem is, if you don't treat the pain at the early stage, you could end up with a situation, and 99% of the time you end up with a situation where they are actually worse off than they were because you haven't treated the pain, at source. So it's really important that that you have your vet on board, and you build up a good rapport with your vet, so that you build up a good relationship with them as well, and they understand your needs and your dog's needs, and they get to understand what works for your dog, because even though it's a really common condition and common disease, inflammatory disease, the approach is very individualized. Okay, so just like we're also individual, and it's trying to find what works for the individual dog as well. So what pain medication works, what complementary therapies work for your dog as well, and what combination of them work together. So you've got your vet on board, you've got your physiotherapist or rehab therapist professional, so they're they're liaising with the vet all the time. You've got your hydrotherapist then coming in on board. They can help them with improving mobility when an animal in particular finds it difficult to exercise on land. So that's where hydrotherapy really comes into its own, because the non-weight bearing forces, so it's a non-weight bearing form of exercise, and then your therapist can come in and help with promoting certain movements and weight shifting exercises to increase engagement of certain muscle groups, whereas on land they might find that a little bit difficult. So, and then bringing in your acupuncturist can come in on board to help with pain management as well, helping to increase blood flow to with target tissue, but also helping with pain relief as well. So also like dog behaviorists, can be involved as well. So if a dog is, showing signs like, certain behaviors that they're not coping in situations, and pain is a driver of those kind of negative behaviors, I suppose. That's where your behaviorist comes on board then to help, find a path through it all and help support the owner through it all as well, because that can be really tough. It can be really tough road for the dog guardian as well. So with physiotherapy, we are looking, we're looking at maintaining range of motion within the joint, encouraging proper muscular engagement and soft tissue engagement, keeping flexibility, just promoting normal movement patterns, and trying to reduce down the adverse effects of the secondary compensatory movement patterns that a lot of dogs have to adapt to cope with pain. So a lot of what I do is it's a supportive role as well for the pet guardian, because it can be a bit overwhelming. There's a lot going on. Now, not every dog is going to need all of those therapies on board, yes, but it's really good to know that you can pull from different therapies, and they're all complementary, so they all work together. The important thing then is, if everyone's working together, is that there's good communication, that you continue the lines of communication, and very often that falls onto the pet guardian to keep those lines of communication open. And because the pet guardian is a big part of that multidisciplinary team as well, because they're the biggest advocates for their dog, so they help bring everyone together, I suppose. So that everyone's aiming for the same goal.
And it's brilliant to even know that all of these things exist, because our own dog has had issues in the past. I think anyone that's listening in regularly will know that we're managing luxating patella with her, and she's done physio and hydro in the past for managing that and everything. But it's so important to know about it, because even our own vet, when we suggested it at the time, was saying, God, I always forget about physio, or I always forget about that. And it's just simple. It's part of the human condition. We've got so many things to think of in the day that you forget. And I suppose things like acupuncture isn't something that would always be my first go-to, but of course it could be an option. So it's great to even know who you can call into. And like you say, not every professional is going to be essential for every single case, but it's great to know about them, that you can call on them then when needed. And once a diagnosis happens for osteoarthritis, I think because you're saying that so many dogs are living with it, I'm guessing that they can still live pretty comfortable and fulfilling lives, right? Or I
Absolutely.
guess there'll be. I'm guessing that there
Yeah.
might be lifestyle changes, but you mentioned things like, trying to look after the range of motion and to keep muscle mass going and everything.
Yeah.
So I'm guessing that dogs can live happy lives with osteoarthritis.
Absolutely, yes. And I
Yeah.
know it's all a bit negative at the start, but I mean, the reality, it's really important to understand that like osteoarthritis, it's a serious condition and it's a complex condition.
Mm.
Um, and it's because I think sometimes it's just dismissed as they only have osteoarthritis, but
Mm.
actually we have to take it seriously so that it doesn't, so we can deal with it in a positive, proactive way rather than being reactive in our approach, which is unfortunately mostly what I do. It's most I'm seeing cases where we're being reactive to what we're to the issues that are caused secondary to osteoarthritis. So being positive and proactive in our approach is really, really important.
Mhm.
So there's a dog can live a full life, healthy life. It's just about managing. So once you get your diagnosis, it's accepting it,
Mhm.
because I've seen a lot of dog guardians being devastated by the diagnosis because their dreams have been shattered by what they were hoping to achieve with their dog from maybe a sports perspective or just a lifestyle perspective as well. They dreams of doing loads of mountain climbing, whatever.
Mhm.
But it's not the end of the road by any means. It's just changing your perspective and just changing. It's a lifestyle changes. So again, you're thinking about think exercises that don't cause more harm. It's really, really important that dogs with osteoarthritis do move. It's not that you're sedentary, that it's dangerous to move. It's really, really important they do keep movement and that they
Mhm.
keep mobility within their joints and keep their muscles flexible and keep them engaged. But it's the type of exercise is really, really important. So dogs that playing fetch, for example, is a big no-no. Um, those ball throwers are the worst thing that you could do. Now, I was very guilty of doing all of this when I was, when my dogs were younger. I didn't know any better. I used to use a tennis racket with a ball. So I'm not perfect myself by any means, but I know now that it's one of the worst things that you can do. So repetitive fetch games, anything that's a repetitive movement, that causes the dog to run and then sudden braking and then they're turning suddenly and coming back. Those kind of high impact activity exercises can be really, really bad. So frisbee throwing where they're jumping up in the air and then they're landing down again, but sudden darts off, um, and repetitive. So once in a while it's generally going to be fine, but repetitive exercises like that, high impact, is the worst, definitely. Um,
Okay.
but so it's, as I said, osteoarthritis it's a management. So being realistic, it's okay to walk your dog. Um, you know, Sometimes it can be a case that you might have to reduce the length of time of the walks. But generally, um, you might be able to build back up the walks again, because the
Mhm.
thing about osteoarthritis is it waxes and wanes. So you get arthritis it's a progressive disease. So if you imagine a graph, and the line of the graph is going up, okay, but within that line going up, you can see my finger, you get little like peaks, where it waxes and
Waves.
wanes,
Yeah.
but it's still progressing, okay, in the overall lifespan of the dog. So, and it's to be aware of that you will get times where they'll get a flare up within
Mhm.
their osteoarthritis journey, but you can manage that, and that's really important to know as well. It's knowing how to manage that so that things will settle back and they'll go back to where they were previously, and
Mhm.
then they might go for years without any, which was the case with my own dog. My own dog has hip dysplasia. So so with him, he didn't have any flare-ups for years and years and years. When I acquired him, he was about 3 years old, and shortly after I acquired him, I noticed that he was skipping on his right hind. Did investigations. He had an X-ray, and they discovered he had hip dysplasia. So it's his right hip was worse. So once I realized that he was actually going through a little flare up when I noticed it, so then we put him on medication for a little while, but he came off the medication again, and he wasn't on medication for years because I managed him really, really well throughout his life. And it's only in the last couple of years, and he's about 15 now. So it's only in the last year or two that he's been on medication full time, so it is a management really, and getting to know your dog, that, what causes their flare-ups as well. What pattern contributes to them getting a flare-up. So if you had a dog that was diagnosed with osteoarthritis and you noticed that they kept getting flare-ups, well then looking at everything, so looking at their lifestyle, looking at their environment, and what is contributing to them getting a flare-up. There's probably a reason, there's something happening, that's why it keeps reoccurring.
And I'm sure lots of people are using, a whole range of things, like you say, the mild exercise, like supplements, like physiotherapy, and it's kind of like figuring out what works when in the treatment plan as well, and when flare-ups are happening, isn't it?
Exactly. Like, if you had a dog that was, so Ernie, my dog, he was diagnosed quite young. So again, I have had him on a joint supplement all his life, because I was trying to be proactive with keeping everything comfortable, keeping the the body in a state that it was keeping the inflammation down in the body as much as possible. So for it is, as I said, management is key. But like the lifestyle and environmental impact are the two big ones. So I managed his weight very well. So if he looked like he was putting on weight, then I would adjust his diet and, make sure that he was at his optimum weight as much as possible. I looked at floors in our house, making sure that we had good areas of traction where he could go to. And that became more and more important as he aged, actually, because they tend to lose more grip as they get older as well. And they don't have that muscle strength to keep them up against gravity as much as they had when they were younger, so it requires more energy to keep them up against gravity, because they get a natural sarcopenia, which is a natural muscle wastage, or reduced muscle bulk as they get older as well. So then they become a little bit weaker. So you're kind of fighting as they get older. Those things become even more important. But we've always had like area rugs in front of the couches, in front of their beds. They've always had a rug that they can come off to, so that they have traction under their paws. So when they're jumping onto the couch or off the couch, that they don't slip. Because all those little micro slips, so people think sometimes that it's cute when they run down the hall and then they slip and they bang into the wall, but actually all those little micro slips and trips, they can cause osteoarthritis as well, because you're causing like an abnormal force going through normal joints or abnormal joints, which, if that's a repetitive thing that's happening all the time, that can cause osteoarthritis as well.
Issues as well.
Yeah.
And I suppose that leads really, really well into, how can we minimize the impact of osteoarthritis, and are there ways of kind of preventing it coming on so early?
Yeah, so definitely. So the number one is weight management. So keeping them at their optimal weight. That's number one, without a doubt. Number two then is environmental management. So looking at, risk assessing. So any client that comes to me, I'll always say, and go home now and risk assess the house, check for any areas where that they always slip in. So if you notice, if your dog is standing there and their foot is sliding out to the side, or if you ask them to sit and their foot is sliding out, it's the surface is too slippy for them. Now, fortunately, we live in the 21st century where all of us have like laminate flooring, porcelain tiles, so it's great for cleaning, but a disaster for dogs. They just don't have that traction that they would have had back in the 1980s when the whole house and even the bathroom was covered in carpet, So it's, that's the only thing, I would highly suggest just having an area where your dog has a safe area that they can do their exercises on, so non-slip surface. Definitely, even from a young age, as much as possible, having good area rugs at least in front of furniture so that they have that traction when they're jumping on and off the couch. Because jumping down, their front legs are slipping forward, and that's putting a lot of stress and strain on their joints as well and their muscles. And then avoiding stairs, like medium-sized large breed dogs are fine with stairs, but our smaller breeds, like a step can be up to their eyeballs, and so they're doing this big jump up and down the stairs. If they're doing that every single day, 365 days of the year, that's a repetitive high impact exercise as well. So I would definitely avoid that. So either you're blocking off the stairs or you're lifting them up and down the stairs. Also how you exercise. So like there were studies showing that, it's not really the length of exercises that puppies are walked. It's really the type of exercises that they do. So if they're doing, again, high impact chasing after balls, lots of jumping at a young age, it's just too high impact for them. So being really careful about the type of exercise as well, and they're the main points as well. Also looking at it's how you walk your dog. So if your dog is pulling on the lead all the time when you're walking your dog, and they're constantly you constantly have that fight between them pulling themselves out of alignment, and then you're trying to pull them back, and especially if you use a collar rather than a harness. But even if you're using the wrong type of harness as well, that can cause even more damage. Like I had a dog today that was they had a harness that came across the front of the chest. The dog was pulling all the time, and then when I was checking the scapular thoracic mobility, so where the scapula sits against the thorax, the chest, she had poor range of motion, both her scapulothoracic joints, so, but she's also using this type of harness that stops that movement there. So that can have a negative impact, because that mechanism, I'm going down a rabbit hole again now.
But it's, I think all in all, you're trying to say that, it's the little things, the little improvements can really make a huge difference, can't it? Because
they can.
It's such a huge issue, but I think everything is coming together. Just keeping it simple, trying to reduce the stairs, trying to reduce the impact of jumping off the sofa, trying to reduce the impact of skeeting around the place. Maybe consider a supplement. Maybe cut down on the extra, the extra portions of food every now and then if you notice them gaining weight. I think it's all about bringing it all together and helping that little bit. If you improved everything 1%, you'd be doing really well, wouldn't you?
That's it, exactly. And even they say like 1% of, like, even if they lost just 1% of that excess weight, that's going to make a difference, so it's everything combined together. If you're doing a little bit, doing something is better than doing nothing. So if you address the environment one day and kind of have a good look at, from your dog's perspective, how is my environment impacting my dog? Like, do they struggle with are they trying to jump up and on and off the couch? Should I get them steps? Should I help them, by getting steps to help them go up and down the couch? What about jumping in and out of the car? Again, if you walk your dog every day down the woods, but you have to get there by going in the car down there. So they're getting in and out of the car again twice a day, 365 days of the year, but they're jumping in and out of the boot, and you've got a high boot and you've got a tiny dog. That's a huge amount of force that's going through the front legs and through the hind legs when they're getting in and out of the car. So then do you how do you combat that? How do you address that? So do you need to get a ramp or some steps, or are they small enough that you can lift them in and out and train them to weight? So it's really having a good hard think about it, because all the little things that we do every day do make a difference in the long term. So it's really important to have a good think about it.
Yeah, and I think on a final note as well, it's worthwhile just reiterating the fact that there are teams of experts out there already waiting to help you. So like, you're not alone in all this. You don't have to figure it all out yourself. Sure, you don't.
No, not at all, not at all. And even like thinking, about that multidisciplinary team approach, even like Caroline from Dogsercise, does the boot camp. But that, I love that, because it's strength and conditioning. So it's aimed at healthy dogs, okay? But if we were all doing strength and conditioning with our dogs, that would help any dog as they get older keep strong, support their joints, because a lot of the forces that are exerted, all those ground reaction forces and different forces that are exerted onto the body, are absorbed by the soft tissues. And if they don't have enough soft tissues, they don't have enough muscle bulk to absorb those forces, it goes through the joints. So that's more impact that the joints have to take as well. So it's not just about restricting and stopping them from doing certain things. It might mean that you think differently about how you're going to exercise your dog as well, and think more about like ourselves, doing more strength and conditioning work rather than all flat out running. But running is lovely and really important for a lot of our gun dogs as well. They need to run around, they need to be off lead. But again, just thinking about the time, have they warmed up properly before their exercises? A lot of dogs are jumping straight out of the car and running off, and they're gone. They're gone for 40 minutes or whatever, but it's really important to stop them, warm up their muscles properly, and then maybe leave them off the lead, depending on their scenario. But again, a dog that's diagnosed with osteoarthritis, if you're going to your vet physio or your rehab professional, they are going to help you with devising coming up with a plan to help promote good musculoskeletal health, so that you can keep them strong and healthy and pain-free as much as possible, and enjoying life.
Which is really, really important for us all to keep in mind, that there is the positive part of things, and that you can live a long and healthy and fulfilling life as well. Perfect. Thank you so much, Deirdre, for coming on and sharing all of your knowledge with us. It's been absolutely fascinating. I definitely feel like I've learned loads, so thank you so much.
No problem at all.
And once again, a huge thank you to Deirdre for coming on and chatting with us all about osteoarthritis and sharing such valuable information. As always, you will find Deirdre's details in our show notes, as well as our own, of course, for Ruby Reese. So please feel free to check out all of our social media pages and websites. We do appreciate it. If you've enjoyed this episode and know people that might be interested in learning more about this topic, please also do share it out. Thank you very much for listening in. We have another related and very interesting topic next week coming up. And this is particularly interesting for those of us that have dogs, maybe with joint issues and age-related issues, restricted mobility in any way, shape or form. And we have a very special guest coming on to talk about how to keep those dogs active and in top condition, regardless of their abilities. So thank you very much, and looking forward to seeing you again next Tuesday.